This is Tom Lee, Editor-in-Chief of NEJM Catalyst, and we are talking today about progress in advancing value-based care with Felipe Costa, the Director of the Value-Based Healthcare Program in Luz Saúde in Portugal. Felipe has led and carried out several national and international projects in value-based healthcare and is optimistic that we're in a period when this work is accelerating and actually becoming more and more important. We'll ask him to talk about what is happening in his own organization, in Portugal, and in healthcare in general. Felipe, why don't you start by telling our listeners a little bit about Luz Saúde?
Yeah, thanks, Tom. First of all, let me thank you for the invitation. What a privilege to be in this talk with someone that I really admire and indirectly changed my purpose of professional life. It's like reading more than a decade of literature, and now finally meet in person the responsible for that change. So yeah, thank you very much for this invitation. It's a privilege to be here talking with you about what I've been doing, what we have been doing concerning what's value-based healthcare. So Luz Saúde is the holding company of one of the largest healthcare services groups by income and the currently expanding Portugal market. The group is almost 20 units and is located in the north, central, southern Madeira regions of Portugal, so all over the country. And during the 2021, we had also a national healthcare hospital under a public-private partnership that ended in 2022. At the moment, we have each year more than 3 million consultations a year, more than 80,000 surgeons delivered, and almost 14,000 employees. So, and it's every year growing in their consolidation business. So, it's the biggest private group hospitals in Portugal.
Well, can you tell us a bit about your background and your role at Luz Saúde?
Yeah, sure. So I'm actual director of value-based healthcare at Luz Saúde. We have been developing this model for the last decade, for almost 10 years. And yeah, I have a clinical management background. I've done my master and MBA. I've part of the direction of operations. I was really dedicated on oncology. Then I had a glimpse of what was going to be the next vision when you and Michael Porter published some of the things concerning value-based healthcare in the early beginning, and it really changed my approach and the way that I was looking to healthcare, not wanting to treat only diseases, but to treat patients. And so I run all my efforts, and I learned from the best, like from MD Anderson. I went to Harvard, and then I decided that I wanted to go back and see all over the world what was happening concerning value-based healthcare all over several institutions in Europe. Then I'm actual professor of business management and value-based healthcare in Portugal. I've run a lot of projects nationally and internationally concerning implementation of value-based healthcare. And I'm also a researcher about value-based healthcare and what is the really correct variables for us to put in practice and lead this path forward in healthcare, because I think this is important as a need. At the moment, I'm a face of a very great team. So they are working permanently with me, guys more dedicated to clinical outcomes, others more dedicated to costs and to the part of the contracts, another comparing and looking for the benchmark. So we can compare the same things all over the world and be comparing the same results for us to always to be improving, and what is the importance of putting value-based healthcare in action, and what we have been doing is kind of putting all together and putting this in a practice application.
Well, value-based healthcare is hard and it's disruptive to the status quo. So, can you tell us why your leaders and your boards want value-based healthcare to advance? What is pushing them to take on this very difficult work?
Yeah, that's a very interesting question. From the beginning, more than a decade, I have the privilege to have a CEO that had a very important vision and wanted to make a huge bet concerning the application and putting value-based healthcare from the first moment. So Luz Saúde is a pioneer on implementing and developing value-based healthcare model in Portugal. We have more than 10 years of researching and putting it in practice, with more than 40 IPUs and 40 pathologies that we are running at the moment. And it's been kind of struggling in the beginning, because you're changing one of the hardest things, which is changing the culture organization of a company. And it was very important because since the moment zero that we internalized in our mission and vision the concept of value-based healthcare. So since the beginning, our mission was changing our vision, leading to health, being as a leader of healthcare provider with high specialized and complex medical care. And we wanted to be recognized as a reference of excellence through integration of patient care, teaching and research, and to achieve the best outcomes that matters to patient, to the most efficiently and effective diagnosis and treatment, with the most absolute respect for the patient individuality, and to build a value chain, an organization that can attract, develop, and retain exceptional people. So this was very important from the beginning, because we put in our mission, in our values of the organization, one important thing that has to put value as a model of internalized objectives and not volume. Was very important because since the first beginning of the moment, we were able of capturing the attention of all the leaders, clinical leaders, management leaders, and all the environments that you have on your structure, integrated structure, that could deliver this on a mission to achieve most value for the patient. So this was kind of a challenging opportunity in healthcare, because in the beginning, we saw that we had challenges in healthcare. We have increasing of aging in population, the exponential increase in prevalence of chronic disease and multimorbidity. We had three types of crises, like Larson has been talking, like value crisis, evidence crisis, and purpose crisis. We were emerging in a shift of paradigm where evolution of economic evaluation models was a pressure, the pressure of costs, the pressure of reduction of health expenditure. We were needing new instruments of analysis as part of the decision models. So everyone was asking, this is very important to have a different mentality, to have a different culture, so we can know exactly that we are not in a point that we have perceptions, but we have evidence. So this was very important to try to diminish the unvariable and the variation of practice that we were seeing. So we wanted to deliver best outcomes for the patient at the correct costs. So one very important thing was to diminish this kind of variability of behavior that will lead immediately to changes that we were needing in our organizations to focus, to be on our purpose of mission, to deliver best outcomes for the patient at the correct costs.
I think the reducing variability is very important. Can you give the audience one or two examples of some of the work underway?
Yeah, so first of all, when we are looking to this model of uncertainty and the lack of evidence, we really needed to go deeply on the culture organization. So this was the main structure to create a trustful environment, engagement environment, and change management proposition with a common purpose. Some examples that we were able of creating more reduction of variability, for example, for HIP, We were able of creating better mobility in 63% in 6 months, 71% at 1 year, with a reduction of pain of 76% at 6 months and 82% in 1 year. Secondly, for example, in the knee, we had a significant improvement in all dimensions of quality of life with a clear reduction of the overall costs. That was nearly 32% of the overall chain. For example, in cataract, we improved the quality of vision by the pre and post-surgical score variation in comparison even to the benchmark of national register. And for example, in endometriosis, we reduced the rate of new surgery at 3 years. And we now have results of 1.5 when the benchmark is talking about 4.3. This is so major important because the reduction of variability of behavior created better outcomes in the value chain. And you were able of creating this establishing position along 5 and 7 years. So it's not just achieving the results, it's to maintain the results and to maintain the behaviors. For that, it's very important to have clinical protocols, clinical pathways design, but mainly is to give to the clinical the double feedback about the results that you are getting permanently. Monthly, they can see their results, they can improve. We can have meetings that they can progressively make them better. And not only it's important to look for their results, but it's very important to align the ecosystem. So we always have a culture of patient-centric, but it's important to align the ecosystem between payers, providers, and suppliers. Only knowing our numbers, we can align all the ecosystem that we have to really strengthen the balance of what we are creating, not only in the balance of internally impact, but also social capital, because that's important. How can we create more social capital, more social value? It's not only a measurement of internally, it's how we going to deliver this to our society. So there's a very important publication from Ronald Burt from Brokers and Closure that the social value that is so important, the social capital that we are creating can bring us a very important, more balanced ecosystem. And was very important for us because we were able of creating new models of reimbursements and new models of creating better access, equity, inclusion, and diversity when we are impacting outcomes and costs in the value chain. This was a very, very important thing to create a more strategy of internalizing in our culture organization. And the part of the competition that we're having at the moment was very important because competition, as you know, with the work of Libor Daphne, increases significant the engagement of people for them to be continuous delivering better outcomes at the correct cost. So this was very important because we needed this adaptability, this need of coordination, better to engage the loyalty of the whole team to deliver better outcomes for the patient. This was important because the purpose of changing is something that people are not used. The changing to get better results, the changing of, for example, bringing outcomes that matters to patient to a centric approach, outcomes coming directly from the patient, like the use of prompts. That was creating a very, very important thing. And I always tell to my team that we should be careful about what we call the Icarus paradox. Icarus was a god that was flying very next to the sun. And when he was flying next to the sun, he burned his wings. So we have to be careful about the results that we are producing and the way that we are implementing value-based healthcare strategy without knowing our instruments and the purpose of what we are doing. Only measuring correct the outcomes and the costs, that's when we are in the game of value-based healthcare. So that has been a huge challenge of analyzing, of putting everyone in the same objective, having the same culture, and at the same time, having the same direction. Only with this work, with time, and with feedback, with communication, and with evidence, we were able to establish a model that now has, as you know, a lot of measurements for more than 40 pathologies that we can deliver, analyze, and really bring value to our patient and to our society, because that's a very important thing to also bring, and to have a more regulated engagement concerning a common purpose, a trustful environment, an empowered execution to our teams, and a shared consciousness that all the ecosystem need to be aligned with the models to create value among the system that we are creating, because there isn't enough money to pay for the system that we have. And that's the work that we have been doing with a balanced ecosystem, with the providers, with the suppliers, and also with the payers. That's important. And now we are also working with the regulators, because the National Healthcare Services also ask the importance of delivering this in the national level. So it's important to enlarge the concept not only in our organization but in a national perspective to be a reality of what we are getting.
Well, it sounds like fantastic work, and you are amassing social capital even before the payment system has forced it. And I expect that good things will happen, but will it be short term? Will it be long term? We will be following along to see how value-based care evolves in Portugal and in the rest of Europe. Thank you so much for sharing your report with us today. I know it's going to be very useful both in Europe and in the United States and in the rest of the world. We will be checking back with you on a regular basis, Felipe. Thanks again.
Thank Tom, and thank you.